We are grateful that you guys are joining us again. We're grateful also for Rebecca for joining us and talking about Liam and things as life has as it's been after his passing. So Rebecca, thank you again. Welcome back
Thank
to Still a Part
you.
of Us. So Rebecca, can you give us just a brief overview of what happened to Liam and how long ago he passed away?
Mhm. Liam was diagnosed with cystic hygroma, hypoplastic left heart syndrome, and hydrops, all caused from Noonan syndrome, and he passed away December 1st, 2020, so almost 2 years ago.
Yeah, at the time of this recording. So, and if you haven't had a chance to listen to her episode, I would highly recommend it. It is I the entire time I'd be like, "Oh, this is just gut-wrenching," like one appointment after the other, just finding
Yeah.
out things and just having that grief that you were dealing with basically the entire time. So I'm
Mhm.
so sorry about that.
Thank you.
So we were talking earlier about what would be the best way to have this conversation, and I in just talking with Rebecca, I can tell she has a lot of thoughts on different things and what has helped and what has not helped. And so Rebecca, tell me a little bit, maybe the first 6 months looked like for you after Liam had passed away. Just kind of give us an overview of like how you navigated that.
So the first 6 months were really hard. I was really numb. I wasn't eating a whole lot. It's expected.
Yeah.
Um, I honestly felt like my head was being held underwater until we got our genetic results back on if we were carriers or not. But I began therapy, and
Yes.
that seemed to really help. Um, and I actually told my fiance, we actually got engaged 12 days after losing him.
Oh, you
Um,
did.
yeah, he proposed December 13th of 2020. I told him the only way we are going to survive losing our son is by leaning on each other.
Mm,
I've seen and heard of a lot of couples that after losing a child, they don't make it
yeah.
because it's hard. And I said, we have to communicate and we have to work through this together. And I mean, the first 3 months, we were together, and we leaned on each other. And he was my best friend through everything.
Yeah.
And and his daughter, I tell everyone she saved me. She gave me a reason to get up and shower and cook
Yeah.
and do all the things
Yeah.
because I was staying home with her because of COVID.
Right.
And I went back to school and got my medical license for being a medical assistant,
Mhm.
and I went back to work.
Yeah.
So it helped. But
Kind of
I tell everyone she saved me
yeah.
because she gave me purpose.
Yeah. You really do feel like so we were in a very similar situation where we had our daughter and we knew we had to get up for her. Like, if
Hmm.
anything, we had to get up for her. If
Yeah.
we you might not feel like getting up for yourself or for each other, but you
Yeah.
definitely need to get up for that little person that is leaning on you to be fed and clothed, and so, yeah. And then I know that you talked earlier about this is that you found relief through writing,
Hmm.
right? So tell me a
Yeah.
little bit about that and how that helps you process.
So my therapist was kind of helping me try to uncover, that's the word I'm looking for,
Mhm.
coping skills,
Yeah.
Music was one, coloring, and journaling.
Mm.
In the middle of the night when I was pregnant, I would get up and go to the bathroom and I would just cry because my baby was sick and I didn't know how much longer. And afterwards, if I got up in the middle of the night, I would cry and I would go and sit out in the living room outside our room and I would just start writing whatever, letters to Liam, how I was feeling, what I was thinking.
Yeah.
And on his 1 year anniversary, I launched a blog
Mhm.
and I started to share our journey and what that looked like, what it's looked like afterwards. I also share recipes and just a little bit of everything, just trying to help moms who go through this and process it and understand that being mad one day or 1 minute and sad the next or happy, like it's normal and nobody
Totally.
can tell you how to process this because it's different for all of us.
Yeah. And it really like, the way you say it's like You could be mad one day or 1 minute.
Yeah.
I mean, it really is those swings can be quite dramatic sometimes,
Mhm.
and it is and it's perfectly fine the way it comes to you because this grief process is not an easy, clear cut anything,
Mhm.
so
Yeah.
you wrote a lot. Is there anything, that you felt like really stuck out to you in some of your writing that you want to tell us a little bit about? Like, maybe some advice that you found to be resonated with some of your readers?
I did one on, like, what not to tell moms after
Oh,
they lose their baby.
yeah, let's hear some of those. I love that question, actually.
Yeah, everyone's like, "I'm so sorry for your loss, but at least you can get pregnant." And I'm like, "Yeah, I guess," like, what are you supposed to say to that?
Yeah,
Honestly, the best response anyone has ever given me is, "That sucks."
yeah,
And I'm like, I never like I told my therapist, like, I never thought something that blunt and simple felt okay,
yeah. Because
you know?
it actually legitimately acknowledges what happened
Mhm.
and that they weren't trying to fix it, right?
Yeah,
They were just
yeah,
saying, "Sucks. Just
yeah.
sucks."
And I tell everyone, you're gonna go through this differently, but what something that was important for me to go through was I wanted him to be known.
Mm,
I didn't want him forgotten.
yeah,
I want to include him in our holidays and pictures, family pictures and everything, and, like, make sure he knows that he is still loved even though he's not here,
yeah,
and to talk about him. If you guys have questions, ask me.
yeah.
And, my stepdaughter, I still have, like, on my unlocked screen,
Mhm.
when you get into my phone, the picture of me holding Liam,
Oh, uh-huh.
and she will sit there and she will say, "That's my brother. That's my
Oh.
brother, Liam,"
Oh.
and, like, I cry
Yeah.
because she knows, and that means that I've done my part in her knowing
Yeah.
that she has a brother,
Yeah.
and baby Liam, and it's so cute, but it makes me feel good to know, like, that she knows that she has a brother.
Yeah. And he's a part of your family, and you will talk
Mhm,
about him, and he will have a place in your family, I think. Yeah, that makes a
exactly.
big difference, I think. When you said that you try hard to encourage people to talk about it, have you found it to be people are a little awkward still? I mean, or have people embraced that? Have they been willing to bring him up and
Yes and no, it kinda depends, like, a lot of, like, the older generations are
Mm,
kinda like, "We didn't talk about this,"
yes.
and I've kind of found family that I knew have had loss,
Oh,
they don't necessarily want to talk about it, but people that I didn't know, they're like, "I've had a miscarriage too." And
yeah.
I'm like, "What?" Like, never knew.
Yeah.
And, like, these are some of the strongest women I've ever known in my family,
Yeah.
and never knew my entire life.
Yeah.
So I've had people reach out to me, either they're going through it or a family member, and kinda have, like, been like, "Do you have any advice?" Or they'll read, like, my blog, and they'll be
Mhm.
like, "Wow, this was so helpful." Just trying to, like, channel all of these emotions.
Yeah.
But I think the most important thing is just, like, don't tell moms, like, "At least you got pregnant, you can
Yeah.
try again." I've actually had someone tell me, "How long are you going to be sad over this?"
Oh,
And I said, "I lost my son, my child. I didn't lose my car keys. Like, it's not something to just get over, right?"
yeah.
And it kinda shocked me because they've lost an adult child.
Oh,
So it was
yeah. That's they might
yeah,
need to unpack some stuff there. Yeah.
yeah. But just be mindful, I guess.
Yeah. Holy cow, that's crazy. Yeah, I always appreciate when lost moms come and say validate exactly how I'm like, "Don't say that. That's not good." Yeah.
Mhm.
And then now that so you're coming up on 2 years now,
Mhm.
what have you done to honor him or celebrate him? Because I know that you did something on his first birthday and you started a blog
Yeah.
that actually was sounds to be so helpful to people that are going through this, but what other
Yeah.
things are you doing? What are your, yeah, I guess what are your plans on honoring him or celebrating him?
So it was supposed to be on his first birthday, but it ended up being a couple days after. I put together donation bags
Oh, okay.
and I call it Liam's Legacy, and I
Mhm.
put like a little folder with like our story, but also some resources of like what to do if your breast milk comes in, you know.
Yeah.
I never did with him, so but I knew what to do if I was prepared,
Yeah.
as well as like you can reach out to counselors and whatnot. I met a girl who lives in California who makes candles,
Mhm.
and she made me candles and shipped them to me. And I put those in there, and they're like
Cool.
vanilla scented, so it's like a nice calming
Yeah.
smell. And then I put a notebook and a pen in there.
Mm.
And I told them, you know, like I found journaling comforting and easy, like an easier way for me to channel my emotions.
Yeah.
And so it's just a couple little things just to help. And I gave them to my doctor, and then I gave them to another mom who is from my OBGYN's office who
Mhm.
works at the other hospital in our area because they have nothing like that.
Oh, that's
And
great.
yeah, so I actually just gave her some a couple months ago. But I gave a couple of days after Liam's first birthday to my doctor, and I told him, he asked me how I wanted them to get them. Do I want them to get them, you know, during delivery, like after delivery, like I got my box and all my stuff, right? And I said, honestly, that was a little overwhelming. What I would like is that mom that comes in after having her delivery for her first post-op, you know, postpartum appointment, have the conversation there and
That
give it to them.
yeah. Like, I wow, that is I think that would be so helpful because it is overwhelming getting they give you a packet of papers, they give you this
Mhm.
box, and you're like, "I what am I doing with this? What is happening? I have to
Yeah.
deliver my baby that who has passed away," and, like, it's so much, so I think that is so wise for you to ask it for it to be given after that postpartum at that first postpartum appointment,
I
because
think too, because then you have like time to kind of like channel those emotions,
uh-huh, yeah.
you know? So, like, if you say, like, we have a mom that comes here that's gone through your situation, like,
Mhm.
I actually gave him business cards with my blog on it,
Yeah,
and he has those out at his office too. So
that's
that way
awesome.
they're, if they don't necessarily want that, then they can at least read the blog.
Yeah.
And we actually had a miscarriage after Liam. It was 2 months after.
Oh, wow.
And I was 3 to 4 weeks along.
Mhm.
And I didn't know. I just knew that I hadn't had a postpartum period,
Yeah.
and I was like, "I don't know what's going on." And my aunt told me to take a pregnancy test, and it was faint, but it was positive.
Mm.
Told me to retest in 48 hours. Same thing. They did blood work, and for like a week straight, I was going every other day. And I was at like 21 and went down to 19, and then like I wasn't doubling like I was supposed
R
to for blood work.
okay, okay.
And they said that I was having a early term miscarriage. And
Mhm.
so I told him like if they need someone that's been through both sides of that spectrum,
Yeah,
then give them this card.
yeah.
And so that's what they've been doing.
That's great. When you mentioned that you had a miscarriage after the loss of Liam, so were you guys so you didn't know you were pregnant, and were you guys trying to get pregnant?
Yes, and no, we weren't like actively trying, but we
Gotcha.
weren't preventing.
Preventing. Okay.
We're like, whatever happens, happens, you know,
Mhm.
and it happened, and
Yeah.
but it didn't. So that one was a little bit hard to deal with just because I didn't know. With Liam, I had facts, I had answers, I had diagnoses,
Yeah.
and I knew what was going on and why.
Yeah.
With this, I had no idea.
Right. And that's
None.
I think that's unfortunately with the case in many cases of miscarriage is that there's no reason that
Mhm.
like we don't have enough information to because we have also had a miscarriage, but that was before our loss, and it was hard. It was
Mhm.
really hard. And I do wanna talk a little bit more about, if you don't mind, because we talked about this a little bit before, but you said that we could talk about this. You have a daughter now,
I do. Yes.
and so tell me, so you had your miscarriage, and then that probably was in its own self hard as well to go
Yeah.
through that, and
It
then
took, like, 6 to 8 weeks for the miscarriage to clear my system.
oh, gotcha, okay.
It passed on its own, I didn't need a DNC, but the blood work was exhausting.
Yeah.
At that point, I was just mentally between Liam and weekly viability checks, miscarriage, and then having to do weekly blood work, like, I was shot.
It was
Um,
a lot, yeah.
we were projected to get married May of 2022,
Okay.
and we miscarried February 6th of 2021,
Oh,
and I was like, "If we're gonna get pregnant, we have to get pregnant by July 1st, and if we're not pregnant by July, then we're gonna wait until after we're married because I wanted at least 2 months in between having the baby and our wedding
and you're
day
ready
to
to yeah,
regroup,
yeah,
right?
you
So,
need your body needs that.
yeah, so I was like, "I don't wanna be walking down the aisle still pregnant or just giving birth, like, that
Yeah,
doesn't sound like a good time."
yeah.
Um,
Yes,
so we
exactly.
started actively trying, and May May 17th, I took a pregnancy test, and I didn't have any symptoms, but I knew my period was coming, and I wanted to know.
Yeah.
And I was like, "It's probably gonna be negative, but let's just take one." And it was positive. And I was like, "What?" So I called my doctor. My blood work was double, tripling, doing everything I was
Doing
supposed to.
yeah,
And we did not announce we were pregnant, like, s publicly on social media until 22 weeks, until after I saw MFM,
yeah.
um, and I saw my second doctor, not the
Oh,
first
as
one.
you're okay, okay.
Yeah. Um, and, um, yeah, we did all the things, had a baby shower, and she was born this past January. Yes, and
Congratulations.
thank you.
Tell me about a little bit, because I'd like to ask this because this is a pretty common thing that sometimes that, you have a loss and then you have a baby afterward.
Mhm.
How was that pregnancy for you?
My pregnancy was rough, and I actually talk about that a lot in my blog.
Mhm.
Um, Pregnancy after loss, it's just it's hard.
Yes.
I For me to mentally process my pregnancy, I put milestones in front of us.
Mm.
Like, we actually bought our first house last June, and I was like, "I'm not painting, like, I'm pregnant," and we
Yeah.
told my parents and his dad that weekend. And then or we told his dad a couple weeks later when he came over to see the house,
Mhm.
and I had, like, a picture of my ultrasound on the
Oh.
fridge. And my mom, we did, like, the bun in the oven.
Oh.
Um, we're like my fiance was like, "Can you teach me how to work the oven?" And she's, like, showing him, and she opens it, and she's like, "What is that? Did you put this in here?" She was like, "It's a roll." And she's like, "Bun in the oven." "Wait, is there a bun in the oven?" And I was like, "Yeah," and then she started crying, and she started
Oh.
screaming, and she's like, "Honey, there's a bun in the oven," to tell her husband, and it was really
That
funny.
that is really cute.
But I was not painting, um, so I was like, "You guys have to paint, I'll just watch you."
Yep.
And I
Mm.
sat outside a lot that day just because of the fumes,
Yeah,
but
totally.
I put milestones ahead of us, like, we had to reach 12 weeks, we had to reach, 13, 14 weeks when we were told to be
When
okay,
mhm.
because, like, the 12-week thing, I was like, that's when they say you're safe,
Yeah.
but with Liam, that wasn't the case.
No.
A week later, my world came crashing down, and I waited till the 12-week period
Yeah.
to share with the world we were pregnant. Um, and I said, "I cannot announce publicly again until after we see high risk."
Yeah.
And since my doctor had done 2 or 3 additional scans already, so 17 weeks, we were on a date at, like, an hour away, and, um, I went to the bathroom and I started spotting.
Oh,
And I was like, "We have to leave now."
yeah.
And we called the doctor. My doctor was on call that weekend, thank goodness. And I was crying and I was like, "I'm spotting." And he was like, "Okay." He said, "Go home. You're on bed rest. You're not going to work tomorrow.
Okay.
And you are coming in and we're going to do an ultrasound and we will go from there."
Okay.
And I said, "Okay." And an appointment too. And so I called my boss and I said, "I can't come in. I've officially been put on bed rest.
Mhm.
I don't know what's going on." And I went in and she was fine. He said sometimes when they get close to 20 weeks, they put too much pressure on the cervix,
Oh,
trying to figure out like their wiggle room in the
yeah.
womb, and it causes spotting.
Yeah. Okay.
He said, "Baby is perfect. She's healthy. She is fine. 10 fingers, 10 toes. You're
She
fine."
looks great.
I said, "Okay." So 20 weeks, go and see high risk. He's like, "There's no fluid, there's no hypoplastic left heart syndrome, no hydrops, no Noonan syndrome. She's perfect." He said, "To be safe, we are going to do an echocardiogram."
Oh, good. Okay.
I said, "Okay." He's like, "Her brother had a heart defect. We're just gonna roll it out."
Yeah.
I said, "Okay." And 4 weeks later, I went back in and I had a very long scan. I had my
They take
regular high
forever.
risk scan,
Yeah,
and
totally.
then the echocardiogram was like another 20 or 30 minutes. And then he came and talked to me, and he's like, "She is perfect.
So no issues with the heart
No
at all.
issues.
Great.
No heart defect, no nothing." He said,
Rebecca,
"I'll see you."
did you have, genetic testing done on her
Mhm.
earlier? Okay, and everything looks good
Everything was
as
fine.
far as you could see. Okay, and then
Yep.
her anatomy scan looked good, her echo looks good, so everything was kinda checking out. So
Yep.
I like how you've done that where you're like, "Okay, I gotta get to this milestone,
Yep.
and then this scan, and then this thing."
Yep.
Were
And
you
then
pl
it was like next, we need to hit the viability, 24 weeks.
Uh-huh,
Okay,
yes.
we're there. All right, now to get the third trimester. Oh, we're there. Well, okay. You stay in there until after Christmas, ma'am.
Yeah.
Like, that was my one thing. Like, I was like, "I do not want a Christmas baby." A- and I'm like, "There's nothing wrong with that, but that's a lot."
Yeah, yeah, it is a lot.
And I was like, "Okay." And I was like having Braxton Hicks contractions like a lot in
Mm.
December. I
Mhm.
actually quit working the week of Thanksgiving.
Okay, just to make sure that you were
We
taking
were
it easy.
prepared. I was resting. We like did the add up of daycare for his daughter who goes half
Mhm.
the week.
Yeah.
And then like our baby that would go full week. Like it didn't make sense.
Yeah.
So I was like, "Okay, we'll stay home and in a year we'll reevaluate." And so I stayed home and she stayed in and stayed in. In January I ended up getting two infections that
Oh.
started labor, had to go to the hospital, have them stop them. And then because I wasn't progressing,
Oh, okay.
so they just stopped them.
Yeah,
And then I
okay.
had COVID and that started contractions again. They stopped them since I wasn't progressing. And then 2 weeks later it was time for delivery.
Okay.
So
And she
yeah.
came, like, at 40 weeks or I guess you guys probably maybe went
30, 39, and 3.
okay. Well, awesome.
So, yeah, I ended up with an emergency C-section after not progressing,
Oh, okay.
but, that was very traumatic in its own experience.
Yeah.
But, she is healthy and everything. She did have, like, oral ties, lip, tongue, and bilateral cheek
Oh, okay.
ties,
Mhm.
and we had to do, like, surgery for that
Yeah,
and
okay.
stretches and therapies and stuff like that, but I mean, in the
And
grand scheme of things, like, everything has been perfect
yeah. Well, good.
besides that. So, yeah, she's
Yeah,
perfect.
it's well, it is a nice story to be able to tell after you've had a loss.
Yeah.
Like, and despite the loss, I mean, it doesn't negate it, doesn't get rid of
Mhm.
it or anything like that. Liam is still your son, but there is something really kind of like, okay, we got our little Madison here. Okay.
Mhm.
Yeah, you can
Yeah.
kind of breathe finally, right?
Yes, she's 9 months and she's crawling and standing herself up to stuff, yesterday she stood up and then, like, took a couple steps holding on to something, trying to, like, get her
Fun.
footing,
Yeah.
and I'm like, "Where did my baby go?"
Yeah. Yep.
So, it's
It's
amazing.
yeah, it is amazing. Rebecca, this has been really just a fun conversation. Is there any other bits of advice that you would like to share with us before we close up today?
Advocate for yourself and your baby.
Oh my goodness. Amen to
Like,
that.
that's a huge thing, like, I see a lot of women that, go through similar things, and they're like, "Where do I even begin?"
Yep.
And I was very vocal with all of my doctors in my care
Yeah.
that I would not be terminating unless I had to.
Yeah.
I would not deliver unless I had to.
Yeah.
And this is, I wanted skin to skin, I wanted vaginal delivery if I was able to, like, I wanted to latch, like, I wanted all of these things, and this is
Mhm.
how I wanted it done.
Mhm.
And I got what I wanted for him,
Yeah.
with him. And if your doctor's not willing, then find another doctor. Like,
Yes.
really,
No,
I
I
did.
yes, I think that, like, that is that is a great piece of advice because it is so easy just to because it's, like, unfortunately, our medical system is in such a way that, like, sometimes you get kind of hurried along right through the system. Like, you
Mm,
just like, "Okay, you look fine, good," and everything, but then you're like, "Oh, wait, I had all these questions." So, you do need to be an advocate for yourself in general. Like, I think in the
mhm,
especially in the medical system, but especially for your wants and desires, especially with your this kind of loss, you wanna be able to create the memories
yeah,
and, have what needs to happen, as best as you can. I think that is a one great piece of advice, and also, I wanna point out, like, you it's your right too. Like, you wanted to you're like, "I do not wanna terminate this pregnancy." That was your right to do that and, to speak up for yourself for what you believe in. And then also, like, I love the fact that you're like, when you at your postpartum, you're like, I gotta leave because this is too hard
yeah,
on my mental like, on
yeah,
me mentally and emotionally." Like, you need to sometimes get up there and not get into somebody's face or anything like that, but
yeah,
to say what's needs to happen. And I feel like the way you did it was really a nice way of doing it. I mean, like, because you said, "If they can't see me soon, I'm gonna have to come back at a different time." And it wasn't being
yeah,
a jerk or anything by any means, but it was very, "This is what I need to do for myself. And
yeah,
if it doesn't work this way for you guys, then cool, we'll do a different time." It
yeah.
is what it is, so
Maybe not wait 45 minutes like I
yeah.
did.
No, but the thing is you're like, you kinda think, "Okay, I can do this. It'll be fine." And then you're like, "Just kidding, I can't do." So I think it's a learning process too,
Yeah,
right?
it was, like, after the 6th or 7th baby that came in, I was like, "I'm drowning.
Yeah,
Help.
help.
Like, please get me back there because if not, like, I have to go on the other side of this door."
Yeah, exactly. Yep, yep. I think those are I think that is awesome. And then just I also wanna point out that, you were also an advocate for when you had your baby afterward, with Madison, 'cause a lot of
Mhm.
those ones were like, I wanna know these things. I wanna find out these things. I wanna get the testing that like, I really think that same thing, being an advocate for yourself while you're maybe experiencing a loss, and then also if you get pregnant or having a baby afterward to really speak up for yourself. I think that is a great piece of advice.
Thank you.
Yeah. Well, Rebecca, thank you so much for your time today. It has been wonderful chatting with you, hearing about Liam,
Thank thank
and
you.
thank you so much because I know that it's gonna help somebody. It usually
Thank
does.
you.
So thanks again.
Thanks.